Hi! How are you guys doing? Kamusta po? So, we are going to talk about an underweight child. Are you worried that your child is skinny, looks very thin to you, and is not a good eater? Well, he or she might be underweight. And then in this talk, we are going to talk about how do doctors define an underweight child and what puts him or her in that category. We are also going to talk about what are some of the causes why your child might be underweight. And lastly, we're going to talk about what you can do at home to help him or help her gain the weight, like what foods you can give most especially. So keep watching and enjoy the video, right? So my question for you, is your child underweight? Malnutrition is defined as an imbalance in a person's intake of energy. Might it be a deficiency or an excess? So we have two ends of the spectrum. A child who is thin and skinny, and then a child who is fat and overweight or even obese. So these two sides of the spectrum are called malnutrition. And in response to this, the World Health Organization aims for a world free of all forms of malnutrition, and the goal is to achieve health and well being for everyone. In this talk, we are going to focus on the deficiency side. Under nutrition, there are several categories. There are three. First is wasting. Wasting if there is a decrease in the weight for height of a child. And in stunting, there is decrease in height for age. And in underweight, there is decrease in weight for age. In this talk, we are going to focus on an underweight child. So, is your child underweight? It is defined as a weight for age that is less than 2 standard deviations of the World Health Organization Child Growth Standards. So we base it on a graph and plot it based on your child's age and weight. Child growth is very important. It is internationally recognized as an important indicator of the nutritional status and health in populations. The weight is easy to measure. That is why usually it is the first thing we look at. And as I've mentioned, the weight for age based on the World Health Organization growth standards. An example of that is what you see on the screen. Evidence has shown that an underweight child is at increased mortality risk, and it is even more increased for a severely underweight child. Weight for age. It is the body mass relative to a child's chronological age. A decrease in weight for age simply means that a child is light or underweight for that age. It also reflects a process of gaining insufficient or not enough weight. So, a child who is underweight and based on a decrease in the weight for age, it can be used to assess the changes in the magnitude of malnutrition over time. So, we follow over time where the child is at in a graph. So, how do we doctors, especially pediatricians, approach an underweight child? So, children grow at a steady rate of weight gain as they grow. Problems arise if there is significant weight loss or if a decrease in the weight gain over time, as we will be able to see in a graph where the weight would fall off the curve. That is why proper tracking of height and weight changes in children is important. We do this to be able to identify potential problems. Now, we are going to discuss some of the reasons why your child might be underweight. The first reason is that he or she might be eating too little food. It might be because of behavioral issues, like your child is a picky eater, or he has attention problems, or is hyperactive. Also, it might be from decreased appetite, like your child drinks a lot of non-nutritious liquids like juices. Another reason might be a dietary restriction. For example, the parents are vegetarians and then they train or they raise their kids to be vegetarians as well. Another reason might be from medications. It might be from your child's seizure or ADHD medications. Another reason, your child might have pain or discomfort while eating from dental caries, for example. And another important reason is, of course, poverty and also psychosocial stress. Another category why your child might be underweight is because of increased metabolic requirements. So, this is true for children with congenital heart disease, with a chronic lung disease, and hyperthyroidism. Another category why your child might be underweight is because of increased losses of nutrients from stool, from urine, or from vomiting. Some of the reasons might be from an infection like an acute gastroenteritis or a stomach bug, or it might be from allergies and type 1 diabetes. So, what do you do when you're worried that your child might be underweight? Go see a doctor. The doctor will do a history taking and ask you several questions, and will also do a physical examination on your child. And also, your child might need laboratory investigations. What does your child need? So, all children need the energy in the form of calories, as well as nutrients from a healthy, balanced diet. A healthy diet in a child is not the same as a healthy diet in adults. This is because children have smaller stomachs and would need smaller amounts. And so, it is best that your child receives 3 meals a day with 3 smaller snacks at regular intervals. So, what is a balanced diet for kids? So, kids need at least 5 portions of varied fruits and vegetables. Also, of course, starchy carbohydrates like potatoes, rice, pasta, and dairy. And also dairy alternatives like soya milk or yogurt. And protein in the form of fish, egg, beans. Unsaturated oils in smaller amounts like sunflower oil, canola oil, and olive oil. And of course, fluids, at least 6 to 8 glasses. Children also need to eat healthy fat, so the concentrated energy and fat is needed by kids, especially those less than 2 years old. These kids need energy dense food in the form of whole milk, cheese, yogurt. And after 2 years old, you can go to a lower fat dairy and cut down on some fat. And after 5 years old, you can give your kid a low fat diet. You also need to be careful about including these foods in your child's diet. Number one, sugary drinks and foods. This is because when sugar touches your child's teeth for prolonged periods, they may cause some damage. And also, be careful about unsaturated fats in burgers, sausages, and pies. And be careful about giving your child whole grain foods such as brown rice, whole grain bread, and pasta. This is because they will make your child feel full before even taking the calories they need. So, what are the best drinks for your child? It's water and cow's milk. So, for children 12 months and up, we give water as well as whole milk. And after 2 years old, you might switch to a lower fat semi-skimmed milk. However, if your child is underweight, you continue giving whole milk. And how about juice? So juices can be a source of vitamins and minerals. However, it is also high in sugar and would cause some tooth decay. So if you really want to give juice, try to dilute it with 1 part juice to 10 parts water. And try to give juices, smoothies, or shakes at mealtime to avoid damage to your child's teeth. And how about vitamins? So for children 6 months to 5 years, it is good to supplement with vitamins A, C, and D. So to help your underweight child, everybody needs to have a healthy attitude towards food, and parents should set an example. An important part of the day should be family time during meal times where everybody sits down on the table and enjoy the food. It should be a fun and happy part of the day. It is also advisable to introduce a wide variety of foods during mealtime. If your kid is a fussy eater, try to be patient and give foods slowly and in smaller amounts. And then, if your child is eating a new food, give him or her a praise. All right? And be patient. Some kids need to be offered the same food several times before they will eat them. And also, do not insist that your child finishes the whole plate, and do not try to criticize them while eating. And of course, even if your child is underweight, you still need to encourage them to be active. This is because it would help them develop strong bones and muscles. Alright, that's the end of our video. I hope you enjoyed it and learned a lot. Thanks for watching! Hi! I hope you enjoyed the video. I am here to provide support and help you raise happy and healthy kids. If you have any questions or if you want to suggest a topic, just type in the comments below. And don't forget to hit like, subscribe, and the bell button to keep posted. Alright?